everyone, let's talk about hyponatremia today. This is one of the figure from PubMed article. So hyponatremia, make sure that the patient is not having pseudo-hyponatremia, which could be due to hyperglycemia. So exclude hyperglycemia and other causes of hypotonic hyponatremia. Once you are sure that the patient is having hypotonic hyponatremia, check whether it is acute or chronic. If it is acute, the patient will be having severe symptoms in the form of confusion, seizures, and other CNS problem, headache also. So consider immediate treatment in this case with hypertonic saline, which is 3% hypertonic saline. If it is not acute or patient is not having severe symptoms, then check the urine osmolarity. If urine osmolarity is less than 100, the most likely cause is primary polydipsia, low solute intake, and potomania. If urine osmolarity is more than 100, then check the urine sodium. Your diagnosis depends on the urine sodium here in this case. If it is less than 30 and the patient is having low effective arterial blood volume, consider it if the extracellular space is expanded, like if the patient is fluid overload, then it could be heart failure, liver failure, and nephrotic syndrome. If patient is dehydrated, if extracellular fluid contracted, consider diarrhea, vomiting, third space loss, or patient might be on diuretics. Next one is urine sodium more than 30. Then always check if the patient is on diuretic or not. If patient is on diuretic, then that is the most likely cause, but still you need to exclude other causes. Sometimes 2 or 3 causes can be coexistent. So if patient is not on diuretic, then check for the same signs and symptoms, that if the patient is having fluid overload, euvolemic, or hypervolemic. So this is if ECF contracted, consider vomiting, like this is the hypovolemic state, vomiting, adrenal insufficiency, renal salt wasting, or cerebral salt wasting. If ECF is normal, the patient is euvolemic, then it could be SIAD or secondary adrenal insufficiency. Here with the vomiting, with the dehydration, it was primary adrenal insufficiency, while if it is euvolemic, this is secondary adrenal insufficiency. Here hypothyroidism is also one of the cause, and consider occult diuretics is the cause as well. So that's it about hyponatremia workup. If you have any questions, please do not hesitate to ask in the comment section.